Hey, my name is Diana Karamakoska, and for this next video, we are going to be looking at models of motivation. Valerians motivational model was developed in 1997, and it draws a lot of information from other models that relate to motivation. It is believed that when an individual has high-quality motivation and is maintained throughout the treatment or intervention program, it will lead to positive consequences, and once these are noticed, it will feed back into that motivation to increase the quality even more so. When we look at quality motivation and relate it to exercise specifically, it's been shown that self-determined motivation, so that intrinsic internal factor of motivation, produces the most long-term persistence with exercise. Exercise leaders and PE teachers can learn to promote self-determined motivation. In a study by Edmonds et al. From 2008 demonstrated with adult exercise classes that the experimental group who had greater self-determined motivation had better attendance throughout their classes. And within the school setting, looking at PE classes, students in the experimental group had greater self-determined motivation and more physical activity outside of school than their control comparatives. When we look at the evidence from clinical research, we can see that patients in a general practicing clinic who met with a self-determination theory trained activity counsellor were more active at 13 weeks than those who did not meet with a trained individual. This has also been replicated with patients whose GPs supported their self-determined motivation and were more likely to quit smoking behaviours. In addition, patients whose dental hygienist has been trained to promote self-determined motivation showed decreases in the amount of plaque and gingivitis present within these clients. Patients who also rate their physiotherapist as more supportive had greater self-determined motivation and thus had better adherence to their intervention programs. So looking back at Valerian's motivational model, the first step is to ensure that the basic needs of your client or patient are fulfilled. This would be autonomy, competence, and relatedness. Having all three and at a high level will produce high quality motivation and follows on to have positive consequences. When we look at the basic needs fulfillment, humans have three needs that are needed for long-term motivation. Autonomy was the first of these, and it is the perception of choice and self-directedness. It's important that when you are discussing programs or intervention treatment options with a client, that you look at a range of choices that they can decide on for themselves and establish that level of autonomy required to move into the high-quality motivation that will contribute to high-quality motivation. This is also tied in with their competence levels, and it's the perception of the effectiveness at which they can carry out the program. When you are developing this intervention program with them, they will be able to assess their own abilities, and together you can figure out ways in which to improve on these capabilities should they feel that they are lacking in some areas over others. And then we look at relatedness, the perception of caring and connectedness between yourself, the health professional, and the client. This will also relate to the support network the client might have from their family members, peers or friends, and also their work colleagues. Social factors such as the professional-patient interaction, as we previously showed, are a big determinant in developing high-quality motivation. You should bear in mind the 5A protocol. This involves asking, advising, agreeing, assisting, and arranging with the client to provide a program that is well equipped for their needs and capabilities.